What is glaucoma? Glaucoma is the second commonest cause of blindness on earth, and unfortunately it is not reversible. So it is very important that we are aware of this condition and diagnose it early. What glaucoma is a loss of nerve fibers in the optic nerve. The optic nerve takes the message from the retina, so as the light comes into the eye, an image is focused on the retina. The cells of the retina read that light and transmit the image down the optic nerve to the brain. You're born with approximately 1.2 million fibers in the nerve. So think of an exchange, a pipe of telephone wires going to an exchange. You require a certain number in order to transmit the message. And what glaucoma is when one loses these fibers too fast. When you lose nerve fibers in the optic nerve, the effect of that is that you get tunnel vision. The trouble with glaucoma is it is asymptomatic. What we mean by that is that you have absolutely no idea you have this condition because it has no sensation, you don't see it, you don't feel it. You're completely unaware unless you are tested. So how do we test for glaucoma? In the old days, we would just simply do a pressure test. But in today's world, a pressure test, so in other words, the pressure inside the closed unit of the eye, we can measure that. A pressure test is not enough. And the reason is that 30% of people who have glaucoma actually have a normal eye pressure. So what we really need to do is we need to scan the back of the nerve with a very special scanning device called an OCT. What that does is it measures the thickness of the optic nerve and thereby correlates if there are enough fibers for that person's age. If there are too few fibers, we call that glaucoma, and that requires treatment. So how do we treat glaucoma? The treatment of glaucoma is to reduce the pressure in the eye, primarily. What that does, that it allows the blood flow to be more efficient and relieves the pressure on the nerves at the back of the eye. Treatment of glaucoma does not give you what you've lost back. So it's very important to make the diagnosis as early as possible in order to preserve the nerve fibers that you have and not lose any more. We also do what's called a visual field test as part of a glaucoma check, and that is a sensitivity test in the outside of your vision to measure how much you can actually see in the periphery of your vision. These tests allow us to track how well the treatment is preserving the nerve at the back of the eye. So it's very important to have an eye professional assess you and make sure that you don't have glaucoma.